As I shared last week, we continue to get more and more real-world evidence on the protection of COVID-19 vaccines provide. And CDC scientists have been working since these vaccines were first authorized to expand the evidence supporting their effectiveness. Today, I'm excited to share information about a new CDC-led study that's being published in the MMWR. This study assesses the real-world effectiveness of the Pfizer and Moderna vaccines in preventing infections among nearly 4,000 healthcare personnel, first responders, and other essential workers in 6 states from mid-December to mid-March. The study found that the risk of infection was reduced by 90% after individuals received the 2 recommended doses of the vaccine. The study also found that people starting to get a protective effect even after the first dose, the risk of infection decreased by 80% after 2 weeks. Findings of this are all consistent with the clinical trial data. Importantly, people in the study received self-collected nasal swabs each week for laboratory testing, allowing CDC to look at evidence of COVID-19 infection whether or not people had symptoms. A small number of infections were asymptomatic. However, most infections occurred among people whose infections were identified by testing before they developed symptoms or knew they were infected. This study also demonstrates that 2 vaccines can reduce the risk of COVID-19 infections, not just in symptomatic infections, but also in asymptomatic or pre-symptomatic infections. This study is tremendously encouraging and complements other recent studies published in New England Journal of Medicine and discussed by Dr. Fauci last week among similar populations at high risk of exposure to COVID-19 because of their occupations. These findings also underscore the importance of getting both of the recommended doses of the vaccine in order to get the greatest level of protection against COVID-19, especially as our concerns about variants escalate.